And that's what I firmly believe in, is like just trying to figure out the root of care or of the symptom presentation rather than just treating what's presented. You know what I mean? Like really dissecting what's going on, because that's where good results are. That's where lasting results are. And that's the intention, is to not, I never want people to get like hooked on healthcare. Like my whole thing is I'm a huge advocate for patient independence. I want to educate people how to take care of themselves and just how to be independent.
Well, today I'm joined by Dr. Alexander Telfair, chiropractor, Sarasota, Florida.
Yes, sir.
Just opened up your practice last year, correct?
Yeah, last end of April, May is when I officially started the practice. Didn't really get things going until probably last August time, but yeah, man.
It's a good field to be in. You know a lot about the medical field, I'm sure, with your schooling and all that stuff, but
Absolutely.
You have a different approach to healthcare, and even within I was looking at your website and some of your philosophy and stuff, even a different philosophy of some chiropractors of how you handle taking care of patients.
Yeah. No, the school that I went to is very focused on holistic medicine. So compared to other schools, like we did adjust in everything. Like we were taught very thoroughly on adjusting techniques, and we practiced a lot. But I would say compared to other schools, the amount of time we spent on that subject was minimal compared to the amount of time we spent on things like microbiology, cell physiology, how organ interplay and the physiology there in between, metabolism of, nutrients, stuff like that. So we really took like a full scope approach to healthcare rather than just focusing on one modality or the other. So when I see a patient presentation, what goes through my head is like, what are all the things that could be, causing this issue? It's like, I'm not just thinking like, is this a joint issue? Is this a muscle issue? Like, we're also going to consider things like environmental factors, patient history, their family history, things that they might be more prone to, autoimmunity, nutrient deficiency. So kind of just look at everything. Obviously, depending on the presentation, we will weigh out those options accordingly. Like, I'm not going to, assume all of those things are present per presentation, but I'm going to take a thorough history and kind of decide which ones have more weight and which ones don't, and go from there.
So you're looking at it more of what we would think almost like a medical doctor does, like a history and physical.
Yeah.
What's actually going on with, your whole body, not just my back hurts or my knee hurts.
Exactly. Kind of like just a holistic practitioner. Yeah, kind of like a so it's funny, in my field, in my school, other chiropractic schools will call us like MD wannabes and stuff like that, because we really do study like diagnosis a ton. And I'm a firm believer that if you are able to diagnose well, you can treat well, because treatments, you know what to do. Treatments are generally, there's a protocol for conditions, but if you misdiagnose, then you're going to mistreat, and you're not going to get the results that you're going for. You know what I mean? The patient outcomes won't be optimal. So we really focused a ton on diagnosis, and yeah, definitely take a full approach. I mean, the big difference between me and medical doctors is I can't use legend drugs, so no prescriptions and no surgeries. And to be frank, I don't want to use either of those things anyway. I firmly believe that before patients should be provided those things, there should be a trial of conservative care within reason. Like Western medicine absolutely has its place. But I found it interesting in school because a lot of my teachers, so in basic sciences, the first year, you're learning about the human body to a T. Within reason. Like, we're not specialists in any subject, but you learn general everything, right? Physiology, anatomy, microbiology, pathology, all that stuff. And the teachers I had were MDs, but they were from India, Russia, Turkey, right? And so, like, they diagnose the same and all that. They're doing the same, approach in that regard, but the treatments are significantly different.
Yeah.
It's like, if you have this condition, use this, eat this food, take this herb, whatever it may be. It's not, here's a prescription. You know what I mean? So it was very interesting learning from them, because they're so intelligent, and like their depth of just thoughtfulness in terms of not, because I feel like prescriptions are a pretty simple thing. It's like, patient presents with high cholesterol, you get a statin. Patient presents with high blood pressure, they start you off on, perhaps an ACE inhibitor or water pill or something like that, right? This was more so like, okay, let's consider how much sodium is in your diet. Let's consider these factors that are causing it rather than just treating the symptoms. And that's what I firmly believe in, is like just trying to figure out the root of care or of the symptom presentation, rather than just treating what's presented. You know what I mean? Like really dissecting what's going on, because that's where good results are. That's where lasting results are. And that's the intention, is to not, I never want people to get like hooked on healthcare. Like my whole thing is I'm a huge advocate for patient independence. I want to educate people how to take care of themselves and just how to be independent, man, because I was an athlete growing up. I had injuries, and when I got hurt, I hated having to rely on people to get better. And so every time I went in, I'd always try to take notes on how can I take better care of myself so I can, manage this on my own. Because being self-sufficient is a blessing. Mm-hmm. It stinks when you have to go to a doctor visit every week because you have to. Otherwise, you won't sleep well, or otherwise you can't function appropriately. Mm-hmm. So, yeah, got on a little tangent there, but yeah.
That's good. So why are most people coming into your office? Because the way you're kind of marketing yourself is not just for adjustment. So are people seeking you out for that holistic care, or do you have people coming in that just want an adjustment, or every once in a while?
Yeah, so a little bit of both. I definitely, so marketing wise, I would say I try to deter from advertising myself as a functional medicine practitioner. It's more so of a privilege that patients will get upon coming in. I advertise myself as a musculoskeletal doctor, and if a patient comes in, they're like, hey, I have knee pain, but by the way, I have high blood sugar, or I have type 2 diabetes, or I have high cholesterol, and they're not already being managed for it, that's when I'll kind of take a step in and say, okay, try these conservative measures, change your diet in this regard, avoid these foods, drink more water, whatever the case may be. It just totally depends on what's going on.
Yeah.
But that's kind of what I'll do. That's when I'll kind of get into the functional medicine side of things. But I don't advertise it, and honestly, the biggest reason why is because as a holistic provider, the detail of note-taking and documentation I have to provide to, basically provide the evidence to substantiate my care is immense. You know what I mean? Like if you're following the standard of care, it's simple. And I don't, because I don't prescribe, but that's the standard of care. Is the patient presents with high cholesterol, you give them a statin. Mm-hmm. And if you don't, you better have darn well good reasoning for not doing that. Mm-hmm. Because like I said, it's the standard of care. That's where the research, the evidence is, which, I kind of disagree with. There's, you go back to I believe in 1918, there was this report that came out called the Flexner Report. And basically what that report said, because this is, when chiropractic started, it was like 1900, or maybe 1895, 1905, but it was still it was interesting, very philosophical. There was very limited evidence on it. Not that it didn't work, you know what I mean? It's just, there just wasn't a lot of substance to it.
Yeah.
People called them like witchcraft doctors and stuff like that. And the Flexner Report basically said, okay, unless there's research on a subject, you can't provide that care to a patient. And then that kind of went a long way. That's pretty much why we have the standard of care these days. So roping back to where I started here, but that's why I don't do a lot of holistic medicine. I'm very capable of it. I'm very confident in my abilities and my education with regard to that subject. But, when I write the assessment for that patient and my thought processes on why I'm providing a certain care, I'm burning 30 minutes just explaining that when I could be doing other things.
Yeah.
And not that it's not worth it. I just try to save it for those that really need it, or that I believe aren't being managed greatly. And luckily, the patients that I do treat, they tend to have good doctors. Mm-hmm. I'll review what they're doing, and I'm like, yeah, I agree with that. You know what I mean? It's like we could change a couple things out, but it's not major enough to where I think it's going to significantly alter the outcome for you. Mm-hmm. You know what I mean? So that's why I focus more on MSK stuff, because not only is that more in my realm and all that stuff, I don't want to step on any other physician's toes. I want to, co-manage people, but within reason. We gotta keep things cordial, and you just can't step on other people's toes. It's like if a doctor provides a patient with something, and I say don't take that. A, I can't do that, mm-hmm. But B, that's just not the way. I should, if I have any issue with something, I'll just call the doctor and say, hey, what's going on with this? Could we try this approach maybe? What are your thoughts on that? Yeah. You know what I mean? Just try to reason through it, because at the end of the day, the intention is just to help the patients to the best of our ability. There's no other interest in my field than just to try to get the best outcomes possible, mm-hmm.
So you mentioned chiropractors in the very beginning being viewed as witch doctors almost.
Yeah.
Now, I know that there's people today that just still write off chiropractors.
100%.
They just, they just want to adjust people. They just want to. So what is your experience with, I don't know, interacting with people like that, or what would you say to people like that about that kind of have that accusation of there's no credibility, there's no...
It's a great question. I mean, some people come in and they're like, is your school a year? Is that what you do to become a... I'm like, no. I'm like, wait. It was technically 7.5 years, 4 years undergrad, 3.5 of chiro school, in which case I did it at, my peers and I, well, a couple of people didn't, but did it at the fastest pace possible. Mm-hmm. So it's like 15-week trimesters. You have 10 trimesters. Each of them are 15 weeks. You get 2 weeks in between of break, and you're taking, around 26 credits on average per trimester. So it's hefty. And it's not like, you're taking microbiome. So like I talked about, like a lot of our basic sciences are pretty much the exact same as an MD. Our and clinical sciences.
Maybe people don't know that.
No.
That you're taking microbiology and chemistries. And
or because we can diagnose. And therefore, to be able to diagnose, that's why PTs don't diagnose, because they don't get that extensive knowledge in school. Like they are capable of it, I'm sure, in some regard, but not in terms of internal medicine. You can't give a PT a lab report and have them dissect the the associated findings or the trends of the data to be able to tell what's going on with the patient. Right. So stuff like that, right? But yeah, I've met a lot of people, man, that have these preconceived notions, and it is hard to even start. I mean, like for me, I don't even know where to begin with those people because their mind is already made up. Mm-hmm. You know what I mean? And to me, I'm like, okay, I'll do my best, and if you give me the time, I'm sure I could maybe change your mind a little, but their thoughts have been made. I mean, and there's that old saying, if you can't teach an old dog new tricks, and that holds water. Yeah. I mean, there's a lot of people I meet where it's like, I could tell them I'm Albert Einstein, and I could be Albert Einstein, and they just said, of chiropractic, you know what I mean?
Yeah.
And they're just like, they're already way past that. They're like, nope, you're a chiropractor. What you do is not real. It's philosophically based or whatever. And I'm like, if you came in and let me treat you, because my physical exam is very hefty. It's very comprehensive. Like I run through everything. My intake forms, we review family history, past medical history, medications list, allergies, all that stuff, surgical history. And then we get into the, HPI, so we do the history of present illness, go into extreme depths with regard to that. Anything associated, try to, break that down. And then the physical exam, we take vitals. We go into... I follow, all the same stuff. So the acronym HIPPY-RONEL, right? So it's history, vitals, inspection, palpation. I'm going to skip a couple because I don't do percussion unless indicated. If I suspect something that indicates that, like maybe, but I'm not doing too much of that, to be honest. And then, we get into some orthopedic testing, and then range of motion and neuro testing. So that's going to be your muscle reflex sensation testing, right? And then from there, it's just like x-rays or labs if indicated. And that's my physical exam. And then from there, I'll tell the patient, hey, here's your report of findings. Here's your diagnosis. This is what I plan to do for that diagnosis and how to treat it. And then we start treating. So that's pretty much like a new patient visit for me. And I don't remember where I was going with that spiel, but yeah.
So what are some of the success stories that you've had with someone coming in and I guess like you really felt like you made a difference, or you took them from where they were to being independent, like you say you want to see people be?
I don't even know where to start with that one. I've helped a lot of people. It's actually one of my most frustrating things is I am a newer business, and trying to get the word out there that like I am just here for results is difficult because half the people don't believe it. The other half, there's always some reason. Like I'm the new guy on the block. I'm a younger person, so it's harder. If I was 40 years old, I think it'd be easier to trust me because they're like, oh, well, he must have experience, even though that 40-year-old might have just gotten his degree last year too. Yeah. So it's pretty funny. But I would say I'll just bring up a couple of really recent cases because they're fresh on the minds, and then I'll bring up one that was kind of a cool internal medicine case. So one of them was this gentleman who, he's a tennis player. And he had some hip pain, and basically, he got imaging done, and they're like, yeah, you're going to probably need surgery based on, the findings and your symptom presentation. And so I took him in, and it was difficult, man. It was, it's like a roller coaster of, get better, get worse. But the thing that I noticed is that the trend was to get better. Mm-hmm. It's like he would come in, and he'd be less, one day and then more the other day. But the time in between of the worsening of symptoms was getting greater. He was having more relief of symptoms than stagnancy of symptoms. Mm-hmm. And so I was like, I think we keep pushing. And then, we did. We started to, get basically the goal with that kind of rehabilitation is you start off with passive stuff. You go into some mild active activity with the patient. By passive, I mean hands-on by the doctor. So we're doing soft tissue mobilization, whatever is indicated that I'm performing on the patient. Then we get into some active care, and we start off with some, active range of motion. We progress that into maybe some light therapeutic exercise. And then we get into advanced exercises where we start to think about like proprioception and stuff like that, right? We start to incorporate those things that basically, if you want to go play tennis again after an injury, you got to redevelop that joint position sense. That is proprioception. It's something we heavily rely on, right? So if I close my eyes and I move my hand over here, I know my hand's over there because of proprioception, right? So, that's one very cool story.
Now, were you sending him home with like, I need you, this is an office visit, but I need you to do this for 30 minutes at home?
Oh, 100%. And that is a huge part of my care. It's like if my patient is not compliant, when my patients are compliant, I look great. When they're not compliant, it makes it harder, it takes longer. And I'm like, listen, if you have any complaints about the funds required for this treatment, like I'm telling you how to take care of yourself at home. And if you decide to not do that, then I don't know, but this isn't some magical thing. But what is cool about it, and it's not the results don't happen overnight. But what is great about it is not only if you go through the process, and everybody's different. This gentleman had this issue for 6-8 years. You know what I mean? So it's like we're working with a chronic arthritic condition. People that come in where, say, you come in and you just hurt something, depending on the gravity of that, if you like tore something, obviously, or had a grade 1 strain or something like that, that takes more time. But people that just have a tweak where it's like, oh, I woke up with a crick in my neck, or my shoulder's hurting because of working at the office or whatever, like I could fix those up in literally one visit. That's a hard part of my job too, is like you don't get a lot of retention when you get people better. It's like, because people get better and they're like, well, I'm good now. And I'm like, yeah, you're good. You don't need me. And if that symptom arises again, here's some stretches you can do on your own at home, and here's some exercises you can do at home to take care of it. And if you get to the point where it's such a burden to you again, which it shouldn't be, but if it does, come see me and we'll get you fixed up again. But my intention is for people to be self-sufficient, like I said. So another success story, let's see here. So I'll go over one. This one was pretty cool. I had a lady who was postmenopausal, having hot flashes like crazy, right? And this is...
Which is something you wouldn't expect to hear from a chiropractor.
Yeah.
It's just unique that you would be considering that and taking care of someone like that. It's not just coming in because my back hurts.
Exactly. Yeah. So, and this isn't something I offer to everybody. And honestly, it was a really cool story though, because she came in with hot flashes, right? And she wasn't sleeping well at night because of them. She was having her emotions. She was not herself, call it manic, and to a degree. It was just like, she just wasn't herself. And so I'm looking at everything. And
thank you for joining me on the podcast. Don't forget to subscribe and let me know in the comments who you'd like to see me have on the show next.
And so essentially what we did is we got the patient on a nebulized pregnenolone, right? And pregnenolone, if you're familiar, is the precursor to progesterone, estrogen, testosterone. In between there's luteinizing hormone, there's all that stuff, right? Just our sex hormones, right? And something that common with postmenopausal women that I learned in school from one of my teachers that's seasoned in this stuff, this is what she did for her practice as a chiropractor, right? Is that, with postmenopausal women, they tend to be a little more stressed, obviously. I mean, that's part of the hot flashes, all that stuff. And pregnenolone will get shunted into cortisol, which is your stress hormone, rather than going down the pathway into progesterone and, that normal pathway. And when it gets shunted into cortisol, that's when you get all these, elevated stress. It's not good, right? And so a lot of people will treat that stuff with like DHA or is it that? Yeah. They'll treat it with some other hormones that are essentially in the middle of that pathway.
Yeah.
And when I'm treating pathways, right, I always want to start at the top of the river, right? If there's a rock at the top of the river obstructing the flow, I'd rather just move that rock rather than supplementing more water midstream to, reproduce that. Because if we're supplementing more water, then that is now the body's going to rely on that water coming in to keep that stream going. But if we just remove that rock at the top, then now the body's going to heal, not heal itself, but it's now that water's just flowing. We don't have to worry about the rest of that. So that's kind of my approach to that. Obviously, it's patient, specific, depends on the presentation, everything like that. But yeah, she took that nebulized pregnenolone for 2 weeks, I believe. And that's, I had her at I researched the heck out of it because obviously I have, best interest of the patient. But I found some really good data on it. And DHEA, sorry, that was the one that a lot of people prescribe. Yeah, DHA is omega-3. Yeah, I was just reading about that.
So you heard that in school, but did you know, are you calling other people that kind of like maybe went to your school that have a similar philosophy on stuff to say like, hey, I've never seen this before, or I remember seeing it in school, but I haven't treated anyone. Mm-hmm. Did you know of anyone else that was doing that? Or did you just remember it from school and do your own research?
Yeah, I remembered it from school because it was a really interesting thing we learned. It was one of the few interesting things about female health that I saw because female health is super complicated. And I was like, that's applicable. Mm-hmm. You know what I mean? Like, that's an easy one. And I just did some research. And, the research basically said that pregnenolone at this dosage is safer than supplementing progesterone or DHEA with less adverse effects, side effects, with better outcomes associated. Mm-hmm. Now, pregnenolone is in, the early stages of being researched, I would say, for sure. But there's definitely some good evidence out there for its uses and lack of side effects, essentially, at the proper dosage, right? You got to consider a lot of things with dosages, for instance, patient weight, patient height, all of that stuff. You got to think about how it's going to get metabolized in the body because you want to have a therapeutic effect, but you don't want to go over and cause, other issues, right? Yeah. Because we're talking about hormones here. We're not talking about water soluble vitamins or something like that. That can just get excreted via, urine, right? So yeah, she took that stuff for 2 weeks, and she's been good since. Her hot flashes are almost non-existent. She sleeps good. Her emotions are under better control, and she is not reliant on any medication or anything.
Why did she come to you? Maybe I said I didn't miss it.
Originally it was just for some pain. I don't remember.
And it just came up.
Yeah, it just came up during treatment. I was like, are you doing anything for this? And she's like, no, they had me on this, on progesterone and DHEA, but I stopped that because it was causing more issues. Mm-hmm. And I was like, give this a try, And
so why wasn't maybe you don't know exactly why, but what would be your guess as to why a physician or an OBGYN wouldn't know about that treatment or consider it?
I think.
Or did they is that something that
some holistic practitioners would, right? But I think this is kind of a novel treatment. I don't think a lot of people, it's called the pregnenolone steal. Right, so there's some data on it for sure, but it is very much a newer treatment technique.
So it doesn't have that massive amount of evidence.
Correct. Yeah, and in a lot of ways, there's a saying in medicine. At least we said it in school as chiropractors. Right, it takes about 10 years for data to hit mainstream medicine. Right, mm-hmm. So if we find today that we found a cancer cure, right. It would take about a decade for that to actually get cleared, go through all the processes to actually hit mainstream medicine.
Clinical trials.
Correct.
And FDA and.
Yep. Yeah. Exactly. No, basically, yeah. I don't know the exact domino effect of sequence there, but it's something of the sort. Absolutely. Yeah. That's my take on that. I'm not really sure. I think a lot of doctors are they got to consider what they're going to get reimbursed for by insurance, and it's not going to be anything that's outside the scope of standard of care. Mm-hmm. They have to abide by certain rules and regulations, and because a lot of doctors take insurance. That you'll find a lot more people that do treatments such as that are outside of insurance. Mm-hmm. You know what I mean? And unfortunately, insurance kind of runs the game.
So in a sense, you have more freedom than a primary care physician?
Yeah. Although, fun fact, I'm not sure. So in Florida, chiropractors are primary care physicians. Right, we can't prescribe legend drugs, so no prescriptions, no surgeries. But I can draw blood, do urine analysis. I had to do, I had to do male and female sensitive exams when I was in school. I, dissected a cadaver for a whole year, so I've literally gone through every square inch of body part, from the brain to the toes to the kidneys and heart. Mm-hmm. We're primary care physicians. I can read imaging reports. I can diagnose off lab reports and treat accordingly. I can do pretty much anything I want, literally outside of pills and surgery.
Yeah, I didn't know you could do blood work and
I had to do a whole 15 weeks of just drawn blood every day. Yeah. I wasn't a fan of that trimester, but just see, I didn't like getting stuck. You know,
Yeah.
I don't mind sticking.
Yeah.
And, you know, I think.
But you got to practice on each other.
100%. Yeah. No, there's some funny stories to that, but for another day.
So what is the main thing that's holding, like the difference between yourself and like what you would call, what we consider a traditional primary care physician? What's holding them back from being able to do, because it does seem like that they are hindered by, I don't know, drug companies or insurance, or they're just hindered a lot. It's like they're not able to practice the way they want to practice sometimes.
Yeah.
They're kind of like put in this little box, and it's hard for them to go outside of that box to do things.
100%. Yeah, and I honestly, I don't know, man. I know for other chiropractors, I can speak on that. And one of my good friends is actually an MD. He works in the trauma unit. He kind of does like the triaging in the trauma unit in Lakeland. But he's, he doesn't really get too limited, but he's a super smart dude. You know what I mean? So like if they want to fight on something, he's like, here's my reason. Here's the data that provide, to support it. I'm going to do what's in the best interest of the patient. I don't care what you guys say. And yeah, he crushes it. So I think you can exercise your scope to your liking so long as you have the evidence to support it. But if you're just, running stuff off of brute memorization, insurance is going to probably win that argument because, for example, like United Healthcare, I was going through their website at one point, and they're like, unless the doctor says they have this lab finding, this symptom, this, that, or whatever, right? They have to do, this stuff. Otherwise we're not going to reimburse for that code. So it's pretty interesting. I mean, they have their own experts that go in here and, dissect stuff and say, here's what you should reimburse, here's what you shouldn't. But here's what I dislike about that is it's generalizing medicine. It's generalizing patients. And we're not the same, man. The causes of our symptoms are not the same. And therefore the treatment for that symptom should not be the same either. I mean, to a varying degree. It's like within reason. So it's just, medicine is an art, not a science. You can't generalize medicine. It's just not it.
So some of it's how hard the physician is willing to fight.
I would say so, which is, it's time consuming. Yeah. Big time. For chiropractors, it's frustrating. I think a lot of us really do believe in like the power of the adjustment, so to speak. I'm personally, I have a totally different perspective on adjusting. I believe it is a great adjunct therapy, but I firmly believe that, well, it's not even a belief. I would say this is a fact. Bones don't just move, right? Bones are connected to muscles. If we didn't have muscles, we would collapse, It's like if a bone is out of place, which by the way is like when people think of a bone being out of place, they exaggerate. Like, and even some chiropractors will explain it in a way I disagree with. It's like they're not moving tragically. Even when you hear the pop during an adjustment, it's really just like cavitation of air within the joint that's being released, like pressure within the joint being released. It's not like we just moved your spine and that's what caused the crack. It's literally just a cavitation of pressure. But yeah, so I don't know. What I believe in is that muscles cause a lot of these pathologies. Like a lot of these aches and pains that we have in the body are just because muscles are too tight, they're asymmetrical, and you have compensation patterns that have developed that issue, right? And so what we do is we just unwind that issue. We take the stuff that's overworking, causing the pain, we break it down, we just call it release that muscle, and then we strengthen up the correct firing pattern. So a super common one I see is like what we call lower cross syndrome, right? So patient comes in with low back pain, they have really tight hip flexors, they have really tight low back muscles, right? And they have really weak core and weak glute muscles. So what we do, we release the hip flexors, we release the low back erectors, right? The erector spinae muscles.
When you say release, are you talking about like, is it more of like a massage, like stretching, or is it what you would think of as like cracking someone's back? Okay,
I hear you. Great question. So when I talk about a release, it varies. So it can be anything, it's soft tissue oriented, and it can be anything from, doing shockwave, which I'll talk about that in a minute. But generally for me, I use a flexion distraction table is what it's called. And so a patient lays prone on the table.
It was that big table that looks like it has hydraulics hooked up to it.
Correct. Yeah, exactly. It's called an Airflex 2, and by Hill Labs, it's a phenomenal table. And essentially, the patient will lay on it, and I'll strap their ankles into the table so we get some traction, right? And they might hold some grip bars at the front or something like that, so that they're anchored in, so to speak. and I will just, the table will flex down, right? And I'll just kind of push up on the erector and then push down. And so like the lower half of the body is bending down, right? And that will stretch that muscle. And so that's one approach I'll take. It's kind of hard to describe without having the physical thing here, but that hopefully that kind of paints a picture a little bit for it. So I'll use that technique, but I'll also use, stuff like cupping. I will do, let's see here, like trigger point release techniques, anything of that nature. I mean, myofascial release, instrument assisted soft tissue mobilization. So that's where we're using stuff like that. I think people are really familiar with like gua sha, but like we use Factor or, stuff like that, just little, instrument tools to kind of like, that's more of a fascial technique. But that's kind of what I'm talking about. So mostly just, I guess, variants of massage to an extent. And then I do a lot of like active release techniques. I have to call them muscle release techniques. I can't call them active, so shame on me. But because I don't have the certificate, but I know the concept. The concept is very simple. It's like you have to know your anatomy to a T, and you basically put a muscle in a contracted or shortened state. You pin that muscle in that state, and then you lengthen that muscle. So you accentuate the stretch, right? Super effective. I mean, I've gotten some really awesome outcomes with that. So yeah, that's kind of what I mean by breaking the tissues down or just mobilizing them, and then we strengthen them, and that's pretty much just physical therapy, except, as a chiropractor. But I firmly believe, I mean, that stuff is essential for patient outcomes. I would say that's one of the most important things is strengthening the body so that it can stabilize itself, become, optimally functional, and you go about your merry way. And you keep doing your exercises every now and then so you don't have pain, So that's kind of my belief. And I think it's tough as chiropractors, man, because like you either go out of network and you can do anything you want, but you're out of network and you get that pushback from patients, right? Because they're like, I want to use my insurance.
Out of network, like private pay.
Correct.
Just cash, no insurance.
Exactly. And so, people are like, I want to use my insurance. And then you as a chiropractor, you go in network. Okay, cool. Now, depending on the insurance, now a lot of people in this area are Medicare, right? And they only reimburse for adjusting, right? Unless they have Advantage plans, and there's stuff in between, but generally people just have plain old Medicare, right? And they only reimburse for adjusting. And so therefore, that's all I can do for the patient to get reimbursed. And basically anything outside of that, I have to have them sign a advanced beneficiary notice or ABN, and they will pay everything else out of pocket. Obviously, they're not too fond of that, right? And I'm like, listen, adjusting is just not going to be the sole thing that helps you recover. Like you would have to come see me forever for that to help. I mean, like, and it would have to be consistent because it's going to keep going back out of place. Like, we need to do soft tissue. We need to rehab that region so that we can, strengthen the appropriate muscles and you actually get out of pain for long term,
So you just mentioned, like, you would have to come back and see me consistently forever. That's what some people think of chiropractors. And I know that's not, like, how you run your practice. Yeah. So why do people get stuck in that trap, I guess? Or why is that a misconception? Or why are people going to a chiropractor a couple times a week to get adjusted? What's the reasoning behind that?
I'd say it's twofold. I'd say the first reason is that some chiropractors heavily believe in the ability of the adjustment, right? And it's what they were taught, and this is, I guess, my opinion at this juncture. I firmly believe in the things I've brought up for treating a patient because I've just seen the results, and to me, the evidence is more supportive of that data than it is of adjusting being an end-all, be-all with treatment. So there is that aspect, but I think it's because I think part of it is like insurance. Like, again, like I was saying, if you take insurance, you're kind of subject to these treatments, and that's why you go into these practices where they're seeing 50, 100 people a day and just cracking backs and they leave. And I think what causes them to stay is that's one of the things and that allows them to get out of pain. I think people get hooked onto that idea of being out of pain, and they think that the adjustment is one of the only things. And I don't know if you've noticed this, but people are either huge fan of chiropractors and going once a week for an adjustment, or they strongly dislike them because they don't want to go once a week for an adjustment. And I'll say this too, like, there's a lot of chiros that will adjust and then they do rehab, and those patients tend to not be the ones that need to keep coming back. But the ones that just adjust, they do tend to get patients hooked to where they're coming in for, like I had somebody call me and they're like, I've been going to the chiropractor for, once a week for, 10 years or something. And I'm like, I'm like, that's crazy. Like, I'm sorry, but I don't know if I'm your guy, because my sole intention with you coming in is to get you better. Like, I don't want you to have to ever go do that again. Like, I want you to come in for 2 to 4 weeks. I mean, sometimes 4 to 6, it just depends on what's going on, how the chronicity and severity of the condition. But yeah, no, I mean, my intention is to get you better. Like, I have no...
So what does that adjustment actually do? Like when they're, cracking necks and doing backs and hips, what is the if you can break it down, like what is it actually doing inside their body? Because I don't.
That's a great question.
Because people do swear by it. They feel better. So what is it actually doing inside of them?
Yes. So we're mobilizing the joint, as the, the structural, right? So we are mobilizing the joint. So this is going to help with the range of motion, and some people will say that it'll decrease tissue tone because if that bone is back in line, then the tissues will be back. And I'm like, well, I disagree, because that's like the chicken and the egg story. It's like the bone is out of place because the muscle is tight. It's not because the muscle's not tight because the bone's out of place. That doesn't make sense to me, because like I said, muscles control bones don't control muscles, right? So that's one. The second thing, there's a cut. So that's the first first one is mobilizing that area. Second one is decreasing tissue tone. The third one is helping with, this is what, chiropractors will say is helping with that nerve function. And sometimes it can absolutely, like, that nerve interference. And there's some really cool stories on it. And there's also a lot where I'm like, man, if you guys don't respond in the first couple of weeks to these adjustments, it's probably not the nerve dysfunction caused by the, subluxation of bony structures. So nerve function will be affected. And then also there's some data on, and this is pretty interesting, is immune system function, right? So there's some data where it's like, there's literally like placebo versus control group versus, the intervention group. And essentially they'll do this adjustment, and then they'll take, blood tests, whatever, see the immunoglobulin levels and all that stuff, IgA, whatever, right? And they'll do an adjustment or something. And I don't know how I don't know what the methods of this data is, but it is interesting nonetheless. And there could be bias or whatever. But after they get adjusted, they will have elevated, immunoglobulin levels and, better immune system function. So that is one of the things as well. And that's why some chiros are like, hey, when you're sick, come see me, I'll adjust you, and that'll help. I'm not a very big believer in that personally. I'm not saying it's not it. It's just I don't believe in that sort of thing per se. After learning as much as I have about it, I'm more of like, okay, let's strengthen the immune system via vitamins and minerals and herbs. Like I'm a huge fan of doing stuff like, angiographis and echinacea, olive leaf extracts, stuff like that, coupled with like, high dose vitamin C, vitamin D, and, zinc, depending on, if it's viral or whatever. So, yeah, I mean, I don't really treat bacterial infections because those are very intense, and they need to go see a physician and get antibiotics for that. But yeah.
Have you had any? I know that there's some chiropractors that will treat for like sensory issues, stuff in like children, like sensory issues, ADHD, behavioral issues, and stuff like that. Is there what's the validity in that, or do you know any of the research and how chiropractic care can affect behavioral things like that?
Yeah, it's pretty interesting. So regarding ADHD, there was actually some data that came out that was like, they took some kids that were in like third grade or something, like they had a bunch of kids with ADHD that couldn't focus. And they took half of them and they gave them magnesium, right? And the other half took a placebo. And the kids that took magnesium had like almost complete resolution of being able to sit down and focus for a 45-minute class, versus the placebo was still about the same. And I think that reflects, to an extent, like our soil quality in the United States has gone down tremendously because of industrialization and just our overcapacity of trying to grow crops and stuff. I mean, we are not mineralizing or getting that soil rich again after putting crops in there, and I think that affects the mineral density, and including things like magnesium. And so I think
regenerative farming.
Correct. Yeah. Huge fan.
I've looked into that,
dude. Whenever I can get regeneratively farmed anything, I get it. Like kefir, pasture raised regenerative eggs, and the difference you feel. I mean, I'm a total feel guy. I do not believe in things. I mean, within reason, like we all have our beliefs, but like food is one of those things where it's like, if I don't feel well after eating it, I don't want it. And if I do feel well, I'm going to keep doing that. And like the difference I'll feel with good eggs versus regular eggs, or, grass-fed A2 milk versus regular milk, grass-fed meat, wild-caught fish, all that stuff. I mean, that is my diet in a nutshell. Berries, I'm a big fan of berries because they have good fiber content. So you kind of get that balance of that glucose spike kind of gets taken care of by the fiber in the berries, and they're just heavy with antioxidants and all that stuff. So that was an interesting one. That's my take on the magnesium. Is I think it is partially from the soil and all that, and also our food system is ultra processed to the max. So everything is. And not only, stuff will be enriched with, certain vitamins and minerals, but like the forms of that vitamin and mineral, not the ones that are used by the body. Like magnesium oxide, it has a poor absorption rate, and that is what's used out of all the magnesiums the most. Depending on what you're using magnesium for, I'm a huge fan of a couple different forms. Like magnesium glycinate is great for like sleep, mood, anxiety, stuff like that. Magnesium malate, excuse me. Magnesium malate is great for like muscle fatigue. I believe magnesium orotate is for like heart health. Magnesium sulfate is good for like any gut issues going on, so like perhaps constipation or something like that. Did I say? No, I meant to say citrate. Sorry. Yeah, magnesium citrate. Yeah, that's more so for constipation and stuff like that. Magnesium sulfate, I think, or chloride. Magnesium chloride, I think, is general deficiency. But yeah, I mean, and then 3 and 8 is good for the brain. That's the form the brain uses. So there's all these different forms, and like depending on the outcome you're trying to achieve, you have to consider the form it's in. And that goes for everything. Like there's all these people that take cyanococobalamin, that's B12, right? That is not the form the body uses. It's like the body now has to take that, convert it into methylcobalamin, which is what the body uses, and in that you're losing substance that could be used for that, therapeutic value, right? And it's like, why don't we just give the right stuff? Like, why is there even stuff that isn't the best? Like, so I don't know. That's just a little frustrating, but so hopefully I didn't get too much into the wormhole on that. But getting back into that's ADHD. I think is a very interesting thing. I think some chiros will. So they will also do something like adjustments, right? And here's another way adjustments are interesting. So the neck and the sacrum, right, are like your parasympathetic nervous system, right? That's where like those sympathetic or parasympathetic ganglions are, right? And then, or not ganglions, I think the sympathetic is mostly, anyway, not to get all into the nervous system. Anyway, so neck and sacrum are parasympathetically regulated, right? Like when you mess with those areas, you're going to kind of stimulate kind of a parasympathetic response, which is rest and digest, right? Just generally going to call it rest and digest. And then, the mid-back and the low back are your sympathetic chains, right? And that's where when you mess with those areas, you're going to have more, you're running from a tiger, fight or flight, right? So some people believe for a kid like with ADHD, and they do get good effects, like I can't argue with it, that if they adjust their neck or their sacrum, they will have a parasympathetic effect and they'll be calmer. And the reason that they're not calm is because that area is subluxated, and therefore that parasympathetic area can't work as well because not getting too much into autonomics, but parasympathetic and sympathetic nervous system, it's not like it waxes and, it waxes and wanes. It's not like one is on, one's off. It's like it's constantly just kind of alternating, right? Like, oh, there's a tiger, we're going to increase sympathetic. And then, oh, we just ate a meal, we're going to increase parasympathetic, right? So stuff like that. We're going to bed or whatever. So that's kind of the idea is they're like, oh, well, because that subluxation is there, we're going to adjust it back and your parasympathetic chain now can work better, right? So... And I think, to their credit, like, I'm one of those people, man, where it's like, if I throw dirt at your feet and it gets you better, I'm going to keep throwing dirt at your feet. You know what I mean? I don't care what's doing it, but there has to be evidence. There has to be reproducibility, right? Those are the things that I'm into. But there's also the power of the placebo and stuff like that. But in this condition, I mean, it's reproducible. Like, there are a lot of kids that will get adjusted and all of a sudden it's like they're acting normal. And it's interesting. It's not what I do. It's not my approach to it, but I can't disagree with the approach if they are helping that person. Within reason. Obviously, it has to be reasonable. So that's kind of my take on how chiropractors help with ADHD. I personally would probably take more of the magnesium route, kind of look at environmental factors. Is the kid on their phone or on a tablet all day, things where they're just getting way too much stimuli, and then when they're bored, they're like, they can't stop moving because they are so used to so much stimuli. So that's kind of the stuff I'll look into. and nutritional stuff. Again, getting back to the magnesium, but other things as well. So that's ADHD. I would say in terms of sensory issues, I would say we're very beneficial, especially depending on the approach. Again, getting back to the idea of adjusting, it has been shown to help with things like proprioception. Excuse me. Things like proprioception, so that's that joint position sense. And sometimes that can throw off your sensory big time, because if the body doesn't know where it is in space, that feedback mechanism is not going to be there. It's going to be like, we don't know where we are. And then all of a sudden the kid has vertigo or something like that, right? Yeah. So that's one of the things. Now, obviously, with kids with sensory issues, you got to be kind of careful, because that can be insidious things. That can be things like as intense as meningioblastoma, right? Mm-hmm. So you got to make sure that you're doing the appropriate triaging of that patient. Make sure that you're ruling out any bad cause, and then once you rule out all the bad stuff, then you can say, okay, let's work with what we got, right? But you have to rule out, especially with kids, because you just never know what can be going on. Yeah. So, being thorough in that population is very important. Yeah. It just depends on the sensory issue, because there's sensory is a very wide range of things, right? That's anything from hearing, visual, smell, heat sensation, so feel, pain sensation, all that stuff. So it just depends on what sensory item we're talking about, and I think the treatment thereof kind of is going to depend on that, right? If it's an ear issue, whether it be like hearing or something, you'd have to, just figure out what the most likely cause is. Is it something like Meniere's disease, where you got too much fluid or endolymph within the vestibular system? Or is it something, as simple as where they just have like some impaction of earwax? You know what I mean? So, you just got to kind of be the doctor, right? You got to figure it out, which is kind of fun.
What other equipment? You were talking about shockwave therapy. Can you just explain that? And then you had another... is that an oxygen? What is that? What is that big
hyperbaric chamber?
Hyperbaric chamber. Can you just explain those two? What do you use them for, and just why why you might put someone in there in the hyperbaric chamber and the shockwave therapy?
So I'll start with shockwave. This I actually just got this past summer, and it is awesome. I've been getting some sweet outcomes with it. Essentially, it's a regenerative medicine technique, right? A conservative one at that. And what we're doing is it's shockwave, right? You hear shock and you're like, oh, there's some form of electricity there, right? Not electric at all. What it's doing is essentially shooting a ballistic air impulse into the body, right? It only goes about 5 millimeters deep. So you got to be careful on what structure, but mostly musculoskeletal presentations, right? It's like tennis elbow, plantar fasciitis. Give me one moment, man. Sorry.
No, you're good.
We're dying.
So that's because I didn't see it. I didn't see it in your office. It's a machine with like a little probe or something? Or?
Exactly, yeah. So kind of like a ultrasound looking thing, but more techie looking, I would say. I'm going to try it. Not even going to try to explain it. It is literally just like a box that is the device, and then it's hooked up to a hose, and then we have the handheld device, and I'll apply that directly on the skin to get to treat the patient. But yeah, essentially what we're doing is we're shooting a ballistic air impulse into the skin and into the body and the affected tissue. You need to find the affected tissue. That is one of the most important things with shockwave. So the protocol is essentially we kind of do like, let's say I have jumper's knee, right? My patellar tendon is not so hot. So we would work on all these quadricep muscles, everything that influences that, right? The knee, the patella, and then the actual treatment itself, we're going to target directly onto that injury area where that pain is. And what that's going to do is that's going to stimulate growth factors to go to that area. It's going to stimulate anti-inflammatory angiogenesis, so increase blood vessels, which is going to help with healing. And we can heal. You can go to PT for jumper's knee and get that thing better, but it's going to take like 4 to 6 weeks. Yeah, I have patients come in for 3 treatments of shockwave, and they're running out of my office. You know what I mean? Like they're pretty much. Now it depends again on the chronicity and severity. Yeah. But it's really cool. Yeah. So that's the shockwave. Hopefully,
is that a new? Like, how long has that been out for? Is that a newer type
probably
thing,
a
or
decade?
Oh, okay.
It's not a very common modality, and I'm just going to say it. I think I have like one of the best. I have like one of the Ferraris of shockwaves. It's the Storz shockwave. And there's just, I say Ferraris because they're FDA cleared. They have a lot of data on that specific shockwave and the intensities and frequencies that it uses.
So the research is there.
100%. Yeah, there's a lot of data on it compared to other shockwave companies. So Now that's my subjective opinion, right? But I'm a huge fan of it, and I have the results to show it. I mean, they are really cool, the outcomes I've been getting. So that's the shockwave. And then the hyperbaric chamber is essentially what that is you get into, now one of the issues is like claustrophobia, right? So people are not fond of getting into this enclosed chamber. They don't realize how much it inflates when you're actually in the chamber. Because like it gets very inflated. I mean, you can crawl around in there if you want. It's not like you're like locked in an MRI unit and can't move. You know, like you can. Now, people aren't doing that. Like I always just say, like, you know, go in there, watch a movie, take a nap, whatever.
It's like a little tent.
Yeah, literally, exactly. So and what we'll do, so we'll put the patient in, we zip it up. You have to make sure that the air is pressurized, so you can't have any leakage, right? And it's a soft shell. It's not a hard shell because, I am a physician, but it's kind of interesting. So federally, I'm not a physician. In the United States, I'm not considered a physician to federal government. But in Florida, right, I am a physician, right? But nonetheless, hyperbarics, I think, are more federally regulated, and therefore I can't use hard shell hyperbarics. They're also more dangerous. They're usually hooked up to, so that's a big difference between mine and others, such as ones used in hospital settings for things like that diving syndrome. I forget what it's called because I always forget it.
Like the bend, it's called the bends?
The bends, yeah, they call it that. So there's that, and they use it for wound healing, so like usually it's going to be like, diabetic ulcers or stuff like that, or just, bed sores, things that are not healing, especially in older populations. And one of the big differences is my hyperbaric is hooked up to an oxygen concentrator. So that takes ambient room air, concentrates it at, from what I heard from the company, it's about 88 to 94% oxygen. That's hooked up to a nasal canalith, right, directly into the nose. And it is just supplying direct oxygen into the body, right? And that's, that's my unit. Essentially, it is a lot safer. There's a lot less risk associated with that because the ones used in hospitals are hard shells, and those are hooked up to pure oxygen. And pure oxygen is very flammable. I mean, oxygen in general is flammable, but like pure oxygen is super flammable. And that's why some people might hear of these horror stories of like there was a kid somewhere in the Midwest, I think it was like last spring, I want to say. And he was in there, and it was not a very well-regulated facility. He had I
think I did hear about
this.
This
was crazy, man. It's so sad. So sad. He's just in there. His mom took him there. He'd been going for weeks or something. It was literally a hyperbaric clinic, and they didn't have the right supervising, crew. And there was this lady there, I think, and she's running the show, and something happened. Like, I don't know if the kid had a lighter in there or something flammable or something happened within the system. I don't know. But it blew up, and it killed the kid and injured the mom and everybody in that room, and just awful. And for a while there, people were like, that's a hyperbaric? Oh, no. And I'm like, no, mine. Because I called the company, and I'm like, hey, could that happen with mine? Like, because I'm not going to use this thing. Like, I'm done if that's the case. Like, what are we doing? And she's like, oh, no, like, actually, the guy that sells these does a presentation to show how not flammable they are. So he'll take a lighter while it's on and put it in there and show that it won't, combust, right? So getting back to, sorry for that spiel, but I thought it was important. So essentially what we do is we throw them in there, we zip it up, make sure there's no pressure leaking, get the patient hooked up to a nasal canalith, we get that pure oxygen pumping in, and then we turn on call it the pressurizer system, which is going to increase the barometric pressure or the atmospheres within that chamber, right? And the intention is essentially to drive oxygen into the body at a higher pressurized, system.
How much is the pressure?
So it's mine does 4.4 atmospheres, right? Okay. So that's essentially what
what do you feel like? I never been.
You know what it's like, man? It's like when you ascend in an airplane. Right? Okay. It's kind of like, because your ears will start to pop. You don't feel like pressure on the body. It's just like your ears. Yeah. Right? So one of the big contraindications is sinus infections. Excuse me. So that is one of the contraindications. The other ones are, like stuff like cancer or, what is the other one, man? I want to say there's like some bleeding disorders that are not ideal with that. Yeah. I forget specifically, but obviously I review those things and make sure the patient doesn't have anything before I utilize that, because safety first. As a doctor or first rule of thumb is do no harm to the patient, right? That is the absolute first, because what are we doing if we're doing any harm to the patient, right? They're here to get better. So that's pretty much what it does. And what we're doing is we're driving oxygen in that higher atmospheres into the body at a very high pressure, right, compared to the ambient air, like what we're breathing right now. And what that's going to do is just to help to, increase the antioxidant potential of the body, right? I mean, oxygen is involved with everything in our bodies. We are aerobic creatures. We are dependent on oxygen. If you take it away, we're toast, right? And so it's going to help to supplement mitochondria to increase, ATP output, essentially, right? Which is energy, right? Mitochondria, I'm sure, everybody took a little bit of bio, the powerhouse of the cell. Yeah, right. That's what we all remember.
It's like first day.
There's so much more to it than that, but yeah, so the powerhouse of the cell, so you get more energy output, ATP, right? And then that energy can be used for healing purposes. The other thing that it's been used for, so the FDA has approved it for like wound healing and a couple other things, I think, but what I've seen really cool results with that are encouraging is stuff like traumatic brain injuries. So mild traumatic brain injuries, obviously, I'm not talking like people that are completely gone and stuff like that, but mild traumatic brain injuries, anti-aging. So there's some evidence, I believe, don't fact check me on this per se, but I think there's some research out there that shows that it is associated with telomere length, right? Are you familiar with telomeres?
I've heard of. I'm not super familiar with them. But
so essentially,
I've heard them talked about.
DNA has like this. DNA is always replicating. As we age, the more we replicate, those telomeres get a little shorter. Also, things like inflammation, environmental factors can influence it. And the purpose of a telomere, it's like this nuclear end cap. So it covers these the ends that if this is like the end of a piece of DNA, it covers it, so it's protected. And essentially, over time, they get degraded. So there's less and less as it moves up, right? And it can help with preserving that. And there's a strong association between not only telomere length and aging, but also disease, right? Because as those genes get exposed, their protective mechanism isn't there. They're more likely to be expressed, especially the bad ones, right? Because we all have genes for stuff, but it's a matter of if they're expressed or inhibited, right? And we want to keep those bad ones inhibited, obviously. And so, that's kind of like a little excerpt of telomeres, right? Doesn't do it justice, but that's the general idea. So there's some evidence, and that's the association between hyperbarics and anti-aging. Also can help with stuff like angiogenesis, so increased blood vessel growth, pretty much like anything and everything healing related in the body. Because again, we're supplementing with oxygen at a high concentration, and it's going to help the body to heal in pretty much any way it needs to. So it's really cool stuff, man. I'm a big fan. It is, depending on the goal of it, it can be a bit hefty. So like to really get a great therapeutic outcome, you need, from my understanding, it's like 1 hour per session, 5 times a week for about 2 weeks, right? And that's dedication. Like that takes time and effort out of a schedule, and most people don't have that type of time. And I can't blame them, but aren't willing to put that type of effort in because perhaps their life hasn't come to that area yet, you know? So a lot of people, when I used to work at a clinic in Tampa. Shout out to them, Bayside Spinal Performance. They were phenomenal. I learned a ton from them. They really helped to shape who I am, and along with all my teachers at school. But it was really cool to be in the clinical setting with them because it was like they were all students from where I'd graduated from, and I got to see the potential of a practice. And they are awesome. But we worked with some NFL players there, and a lot of the guys would come in. Actually, they worked with a ton of NFL players. They were, like I said, they had really made a reputation for themselves, and they were awesome. But they would come in after practice to get like post-workout recovery. So that is another place where hyperbarics are great, is just for like that recovery of the body because, again, you're going to kind of be in an oxygen deprived state post-workout, right? And that's why, well, I'm not going to get into that, but I was going to get into like, aerobic and anaerobic workouts and runners, but that's the way my brain works, dude. But they come in to recover, and it would just help a lot with like, soreness, muscle growth, stuff, just adaptation to the workout, essentially, right?
So what were they doing with because you worked at that place where they had like NFL athletes there, and so I would think that because there's money on the line with, the NFL players want to stay as healthy as they can because that's how they make their money, and the teams and the owners want them to stay healthy. So what are they doing anything different to keep them healthy? Because there's a huge incentive to keep those players as healthy as possible. Yeah. So they're doing the chambers like that. What else are they doing preventatively to keep themselves?
I mean, Everything, dude.
Food,
Everything.
I mean,
from
it's like the food and supplements and
the food. The teams, as far as I'm aware, would usually take care of. But I mean, they would do stuff like IV therapy. You know what I mean? So like a Myers cocktail. It's like the classic IV bag. Has a bunch of vitamins and minerals and stuff like that, just to help with quick hydration. They'd even use like sometimes like lactated ringers to like really optimize hydration. I know a lot of, especially in the hospital setting, it's more so for like burn patients and stuff like that. But it is a more closely, it's better than. What is that other stuff, man?
like normal saline.
There you go. Thank you. I was like, anyway. So yeah, the lactated ringers just are more like similar to the blood viscosity and stuff like that, and better for hydrating somebody quick compared to saline, right? So they would do stuff like that, but anything from like acupuncture to, I mean, they had everything, dude. I saw stuff at that practice where I was like, that is so cool. I mean, the only other place I saw one of the devices was in a video with Mike Tyson before he fought Jake Paul. Because
I would think a place like that, again, there's that incentive, like they have to stay healthy. And so there would just be anything that they can do to really maximize their health, they would be doing.
Absolutely. And that's kind of in the doctor's hands. And he did a great job. I mean, they both did a great job. Like they had no interest on anything but making sure that those athletes were at their peak for every second of every moment, because that can make or break their next year's deal. That can make or break a play that might influence winning or losing a game. You know what I mean? So they worked on every facet of conservative care possible. Yeah. They were phenomenal. It was a really cool experience. Yeah.
So I ask everyone, what is healthcare? And when I mean healthcare, it's anything associated with the traditional hospital system, chiropractic care. Yeah. Can be insurance companies, everything. What is healthcare doing well? What needs more focus? What needs more attention? And how do you get that accomplished? So I know you can spend an hour talking about this.
That's a big question.
But just, 5 minutes maybe, like what are just the most important things that are being done right, and how do we fix it?
Yeah, I would say I'll try to keep it really brief. I would say the monetization of pharmaceuticals is crazy. I think it's just way overdone, and there's absolutely a time and a place for it. I would say as a patient that has severe conditions and stuff like that, there's no better place to be than the U.S. for treatment and care. Like, we have some awesome stuff in the U.S.
Which is what most people say is, if I'm in a car wreck, if I have something traumatic happen, if I break I need the hospital. Yeah. It seems to be like a common thing that, like, what's good about it is like the emergency care, the trauma care, when you need something done right away, they're like, that's what we do that well. Yeah. We do that well. So.
Absolutely. We're way up there in terms of, I mean, there's no better place to be in my opinion. But the general care, in my opinion, is not so great. It's not terrible. It's just there's a lot of influence by insurance. There's a lot of influence by money, right? Stuff like that. Money runs, my dad would always say growing up, if you ever have questions about the world, just follow the money, right? And it's crazy how often I'll find answers where I'm like, man, I don't like that answer, but it seems to be the truth, because what else could it be? What's the other incentive aside from that? Obviously, helping people and all that stuff. But I mean, in terms of like dissecting something, adverse that occurred, it's like, what was the incentive of this person? Because why would they do this if that's obviously not in the best interest of the patient? And it's like, oh, well, money, right? And it's unfortunate. That is not like, there's something I want to be very clear on is like, there's good and bad everything, right? There's a lot of great MDs, there's a lot of bad MDs, there's a lot of great chiropractors, a lot of bad chiropractors, a lot of great construction workers, a lot of bad construction workers. I mean, everything is a yin and a yang, right? If we had a perfect world of perfect people, we wouldn't have any of the issues we have, right? But yeah, I mean, in terms of that, I think pharmaceuticals have kind of overstepped their bounds. I think, at least in terms of patient care, I think it's just become more about funds to some extent than it has about really getting the patient outcome. It's like, how can we get you hooked on this medication for the rest of your life, And there's a time and a place for it, and there's a lot of times and places where it's not a place. It's not for it. It's like, why don't we think about the nutrition of this patient? Like, why are you giving them a statin when they eat McDonald's day and night every day? Like, why don't you talk to them about that? And a lot of them do, to their credit, but a lot of them don't too. And it's just kind of frustrating. So I think that's a part of it. I think a huge part of it is our food and call it, the FDA, the Food and Drug Regulation system. I think it's not good. Like our food system is tragic for like the, for like what the U.S. is and the potential we have as a country. It's like, I don't know why our food system is so poor. Like, and in order to eat well, you have to spend an arm and a leg. And I spend an arm and a leg because I'm like, I'd rather spend that now than spend it on some condition I developed because of it, or perhaps die from. And, and people are like, I'll read this like Wall Street Journal article. It's like, oh, colon cancer's on the rise and we don't know why. And I'm like, come on. I'm like, we know why. I'm like, come on. It's like, look at what these people are eating, Yeah. And there's some interesting data too. Like there's an association between like the gut microbiome and increased risk of it. But I'm pretty sure that the microbiome is influenced by some foods that we eat that will cause, just like genes will get expressed, some of the bacteria they'll get fed more than others, and therefore they're expressed more and they do more good or bad, right? Because there's good microbiome, there's bad microbiota. So I think, so pharmaceuticals, nutrition, and I would say just exercising conservative care when it's appropriate. It's like I don't know why patients will go into some doctors, it just depends, but it's like they'll just immediately jump into surgical options or pills. And it's like, why don't we think about how we could give this patient 6 weeks, right, within reason, whether it's just depending on the presentation, but let's call it 6 weeks and see what we can do in a conservative way. Let's change diet, let's change exercise, let's do the things that we can control, that patient can control, instead of just doing the surgery. Now, the alternative to that is the immediate satisfaction people are after, instant gratification. We are trained in America to love, that is how the market runs, off instant gratification, literally. And it is gratifying, but it's also not so great for us. It's way healthier to work towards a goal and have it. And I would argue it feels better at the end of the day than to just be given something. You know what I mean? And a lot of the times people are like, I want my symptom gone right now, so I'm going to take that pill. I'm going to do this surgery. You know what I mean? And it's like, okay, but what if I told you that you're going to have to go do extensive rehab after surgery, or you're going to be taking that pill the rest of your life to feel good, or you could come treat with me and just do the rehab for 6 weeks that you're going to have to do after the surgery anyway, and potentially be able to just be self-sufficient and not pay the thousands of dollars required for the pills or surgery, and be on your own, be ready to go. It's like I feel like that should be utilized more. I think a lot of it is relative to money, unfortunately. And it's hard not to, because it's not easy. It's tough economy right now. I'm like, I'll think about, $100,000 to me for even a year ago, 2 years ago, was a lot of money. And it's not that much money. It's crazy. Just at least in terms of running a business and doing all that, living whatever. I don't do anything crazy, man. It's not like I'm vacationing or I'm working, I would say, every day of the week, and it's like, it's tough to get by. It's crazy. So,
and I think a lot of the patients, like you say, follow the money. It's almost like it's up to the people to speak up, and they're going to have to kind of like vote with their money. Like if they don't, if all of a sudden there's most of the people in the United States are not on board with something, the system will change.
Yeah, exactly.
And but a lot of that is education. They have to be taught these things.
Yes.
And so I think a big thing that's missing is education. The patients have to be educated, and then they have to take the next step and decide, well, I'm not going to put my money there. And then ultimately the system will follow the money.
Yeah. No, that's a great point, and I should have said that too. Yeah, education is massive. Just teaching people how, I think, we're talking about this prior to the podcast, but like doctor, I think I should fact check this before this, but stands for teacher in Latin, right? And that's what we should be. It's like we should be teachers first, and then practitioners after. It's like or vice versa. It just depends. But it's like we should always be teaching the patient how to do better, how to live their life more thoroughly. Just like when I talk to whatever, a marketing person, they're teaching me how to do better at marketing, right? They're not just doing the marketing. I want them to teach me the marketing so I know what's going on. Same with, patients should be taught what's going on more than just being treated for it and being dependent on doctors, And I think that's a huge thing is, yeah, that's like the same thing I keep getting back to is the self-sufficient or, patient independence. It's just, that's the goal. But yeah, no, it's super interesting, man. And then in terms of like fixing the issue, right, I think it has a lot to do with lobbying, right? It's like as practitioners or, the people that do believe in a better system for the people, we have to go directly to these government officials and say, hey, this is what's going on. This is how it could improve, and that comes with, that also requires a lot of money and a lot of people and a lot of signatures and just depending on it and time and energy and all that stuff. But it's a tough one, man. It's a tough one, but it's definitely a worthwhile one because it's for the greater good of the people. And there's always going to be some people that maybe don't benefit from it or whatever, and it's really hard. But I think there's a great saying. I believe one of the Roosevelt said it, and it's like you do the greatest amount of good for the greatest amount of people, and that's all you can do. It's like you can't ever please everybody, and unfortunately, that's the truth, man. It's impossible. There's too many people, but you just do your best for the greatest amount you can. Yeah. So that's my short answer for that.
Yeah. All right. Well, unless you have anything else to add in closing, feel free to. But thank you for coming on, and I enjoyed the conversation. And I think you opened my eyes, anyways, to like everything that you do as a chiropractor, because I think there can be a misconception about how narrow the chiropractic field can be. Yeah. But at least you, anyways, in your practice, you're doing a lot of stuff.
Yeah, absolutely.
You're doing a lot of, just even from the blood work and, all the, reading images and stuff like that. I really like the way you're doing a more holistic approach to health. So
absolutely.
Anything else you need to add and let people know your social medias, where you're located, how to get a hold of you if they want to come by and see you?
Yeah. Well, I'm going to start on one thing. So I'm not drawing blood in office. Not right now. I don't want people coming in for that per se. I prefer, when patients come in, I prefer patients with like musculoskeletal presentations. So like elbow pain, foot pain, neck pain, any pain in the body. And if you have some other stuff going on, I will totally, if you need a script to go get blood work, we could do that. And I'll read the blood work, but I always prefer to co-manage with their primary care doctor, because I'm not here to like do stuff behind the back of other doctors. Like we're all in this together for the patient outcomes, So I just want to make that clear. But so let's see here. Closing. Okay, so I'm located in downtown Sarasota. I'm off of Orange, near Burns Court, if you're familiar with that area. I'm by appointment only at this time. I'm also the receptionist, so you'll be talking to me if you give us a call. My number is 941-685-2415 if anybody is interested in becoming a patient and, getting to that optimal health that we all aspire to get to, or I hope that we do, because I think that's another thing I experienced, man, is a lot of people have no idea what it's like to feel good. They're so used to just feeling the way that they feel, and it's like, man, if I could introduce you to this, just honestly, I don't even need you don't need to sign up to be a patient. Like I'll just be like, hey, eat these foods. Like we could, on the consult, I could just say, hey, when you're at the grocery store, don't go in the aisles, just stay on the outside. Get whole foods, get meat, veggies, your protein, try to get wild caught, fish or pasture raised, food, meat, right? So you're, like cows and chickens and whatever. Just try to minimize the snacks, because the snacks are where all the bad stuff is. So that's my spiel on that. But so anybody that's interested in working with me, I'd love to help you. I'd love to talk to you. And I'm just here for the people. I'm here for the greater good of those I serve. So that is what's going on, and very much appreciate being on the podcast with me. And it was very good chatting with you.
Yeah. Thanks for coming on.
Of course.